Good morning. Let me join the chorus of staff, faculty, and students who are welcoming you to orientation. This is truly an exciting time for all of us as your students begin their college career. I'm going to talk with you about the services we have at FGCU to ensure the health and wellness of your students. I will talk about prevention and wellness, our health education department. I will talk about the student health clinic. I'll talk about CAPS, counseling and psychological services. And I also will share with you some information about adaptive services, which is for our students with disabilities. I'm going to start off by sharing with you information about today's students and their health and wellness. What we find is that the emotional and behavioral issues are the most challenging for students today. There is more stress and anxiety and depression among college students today than ever before. College presidents and student affairs officials report that the mental health of college students is their #1 concern outside of the classroom. I'm going to share some data with you. I'll try not to bore you with research, but I will share one research study. And by sharing the data and research, I am providing what psychologists call informed consent. It basically means that you are informed about the situation and about the issues, and you can better help your students succeed. One quick way of understanding some of these issues is to just look at the popular books that have been written about this generation of college students. When Fear and Hope Collide, College of the Overwhelmed, Generation on a Tightrope. Those titles aren't just there for selling the books, although I'm sure that's part of it, but it's really what these researchers and what these authors have found about college students. So let's start to talk about this generation of college students. Most of you know that they're called the Millennial Students. I'm going to share with you some information about this generation of students. They tend to be the most protected and supervised generation and have lived sheltered and structured lives. They have passionate, nurturing parents and were raised to see themselves as special. You all emphasize self-esteem. They're more inclusive and tolerant of religions, ethnicity, and sexual orientation. They are the most ethnically diverse generation we've ever had in this country. They acknowledge and respect positions, titles, and rules, but they frequently challenge them. They're technologically savvy. They're self-taught through experimenting and exploring. Basically, students today communicate electronically. They live, learn, and relate through technology. One of the authors called this the new tribalism. One of the things I get for being here a long time is that I have the very first parking spot in the parking lot next to the student plaza. And every day when I come in, I look at the students sitting at the shuttle stop. It's our largest shuttle stop. And I always pay attention to how many of them are talking to each other versus how many of them are basically on their phone with the tribe. Some days I go 17 for 17. So, what else they are good at, if you will, is they're good at multitasking. They do that very well. They don't learn from failure. They have exposure to vast information, but go less in depth, which is a criticism of a lot of the faculty. They are intent on their education, as you are, as parents. And basically, they've been pushed by all adults to study hard and to succeed. They value their interpersonal relationships highly, and success in these relationships is primary. There's a high value on peer bonding with this generation. And I know some of you have had experiences where you've tried to maybe direct some of that peer bonding. Maybe you haven't exactly liked one of the friends that they've picked. And if you tried to do something or to change that, I imagine that was quite a challenge for you. But the bottom line, I think, is that as we study this generation, we know that they're the most anxious and stressed generation we've ever had. One of the authors who I really like, she's done an awful lot of research, is Jean Twenge out of San Diego State University. And she recently wrote a book about this generation, and she called it the I generation. Just got published in 2017. I would recommend it to anyone. I'm sure she's done a really great job on her research and looked at this generation of adolescents. So, some of the points. This is the first generation born since 1995 with smartphones their entire adolescence. Internet access has always been available. Social media has replaced many activities. They spend less time in person with their friends. They're growing up more slowly. 18-year-olds act like 15-year-olds. She's also found some other things that are kind of interesting, like the average 8th grader checks her phone more than 80 times a day. An 8th grader who spends 10 or more hours a week on social media are found to be 56% more likely to be unhappy. This generation, the I generation, as Dr. Twenge calls it, is experiencing unprecedented levels of anxiety, depression, and loneliness. The rates of depression and suicide have skyrocketed since 2011. So let's look at college students and what they tell us. The freshman survey is given to students going into their first year in college. And the latest data is on 134,000 FTIC students at 184 four-year institutions. And this is just some of the information that they find. Overall, 12% report feeling frequently depressed. 14% said there was a very good chance they would seek personal counseling while they were in college. Among the 11% reporting having a psychological disorder, it's even higher, 36%. Overall, only 47% consider their mental health above average as it relates to their peers. You know, students like to think of themselves as being above average in things, but when it comes to their estimate of their mental health, more are likely to say, no, I'm just average or not even average. A question you might ask is, what is the reason for this downward trend in the feeling of wellness among incoming students? This is just an example. Finances. The report they have on finances is very different than it used to be. For example, 56% of students have some concerns about their ability to finance college. For the first time, slightly more than half of incoming students say there is a very good chance that they will get a job to help pay for their college expenses. And this is especially true for first-generation students, where 75% of them say they will most likely get a job. So, I'm going to bore you with one research study, and this again is by Jean Twenge and her colleagues. And this was very significant to me because it has a lot of things that psychologists are interested in. First of all, it was cross-sectional, which means it was done over a period of time, looking at samples. And what she did is she took a particular personality assessment called the MMPI, and she went back and recovered as many of the samples of college students taking the MMPI since the 1930s. The MMPI is the most popular personality assessment in the world. So this is what she found. There was a linear increase in successive generations of students. Psychologists get excited about linear relationships. In other words, every year, or every generation, the amount of psychopathology that was measured on this instrument was going up. Today, more students are characterized by unrealistic positive self-appraisal, overactivity, and low self-control. More students feel isolated and misunderstood. More students may be described as sensitive and sentimental. The general symptoms of anxiety are on the rise. More students are predicted to experience moodiness, sadness, restlessness, worry, dissatisfaction, and instability. One of the neat things about this particular study was that she tested theories about why is this? What explains this data? And there were 3 or 4 theories that she tested. But this is what she found had the most support in terms of why things have changed for students over time. There's been a shift in American culture towards materialism, individualism, striving for status, unrealistic expectations, and unstable relationships may account for the increase in psychopathology in young people. The conclusion? At the very least, college campuses now have a larger percentage of students with more serious mental health problems. Okay, so let's shift and let's look at what students are telling us. In particular, students at FGCU. We're going to compare FGCU students to national results. So we call that a reference group. So all the other students who've taken this particular instrument at this particular time. So this is sponsored by the American College Health Association. What I found is that results have been amazingly consistent over the last 5 years. So there isn't much variance. FGCU student data is reported with the national reference in red. So here we go. If you're still with me and awake, you're going to see basically that FGCU students seem to be struggling a little bit more. I have a theory about that, but I don't have time to explain it. Okay, students are generally pretty healthy. 84% rate their health as good or better. And you have between 6 and 7% of students who do have some kind of chronic illness, cancer, diabetes, and so forth. So insurance companies know this. This is why student health insurance is so inexpensive. They know that basically you have a pretty healthy population. And if you look at the 5 illnesses treated in the last 12 months, you see things that are really pretty typical of primary health care in this country. Allergies, sinus infection, urinary tract infection, back pain, and migraine headache. Again, I'm reporting the percentages for FGCU students, and the reference group is in the red. Now, I know all of you have talked about doing healthy things and healthy behaviors. Students don't do so good at that. Basically, we find that only around 38% eat 3 or 4 helpings or more of fruits and vegetables, even though you've preached that for a long time. Only 44.6% meet the American College of Sports Medicine and American Heart Association recommendation for exercise. So they're not eating that well, and they're not getting enough exercise. And I think this reflects our American society in general, but about 38% classify themselves as overweight or obese. In the past 7 days, about 45% of students report getting enough sleep to feel rested 2 days or even less. And I know that stands out a little bit. Students really suck at sleeping. They have a lot of problems with this. And you'll see more. Within the last 12 months, 59.2% rated their level of stress as more than average. And yes, students do have sex. 67.5% had a sexual partner in the last 12 months. It's why we do programs on sexual awareness. Okay, so let's shift a little bit and talk about some of the emotional, behavioral, and relationship issues from this particular survey. So again, I'm reporting FGCU student results, and in red is the reference group. And the findings are related to whether or not this has been part of their life in the last 12 months. So here we go. 89% felt overwhelmed by all they had to do. Students found something traumatic or very difficult to handle in their lives, and that's almost 79%. 67% felt overwhelming anxiety. 52.8% felt things were hopeless. You don't do very well if you're hopeless. 46.3% felt overwhelming anger. and 45.7% reported being so depressed it was difficult to function. These are pretty startling percentages that students are telling us about how they're doing in terms of their emotional and behavioral health. 15.3% seriously considered suicide. 9.2% intentionally injured themselves. I know a lot of you as parents have, it may not relate to you, your student, but your student may have known somebody who self-injured. 10.4% reported an emotionally abusive intimate relationship. 8% reported stalking, and 17.3% reported unwanted sexual activity. Overall, at least 1 in 5 college women still report being a victim of unwanted sexual activity. So, we ask students, okay, what gets in your way? What keeps you from succeeding? What keeps you from doing well on an exam? What keeps you from getting a better grade? And I want you to come up with something right now because I'm going to show you what students say. Here's the top 10 impediments in academic performance according to students. It may not be what you were thinking. Stress, sleep difficulties. I said that would come up again. Anxiety, work, depression, concern for a troubled friend or family member. You may not think they care about you, but they do. And if there's issues in your family, it does impact them. Relationship difficulties, internet use, computer games, that wasn't on this survey 10, 15 years ago. Not as one of the top 10 anyway. Colds, flu, sore throat, and finances. There's something unique about this list. If you look at this list, everything here, at least all the first 8, are basically emotional or behavioral. Okay, so what do college counseling center directors tell us? I belong to a group, an organization of over 900 called AUCCCD. That's a heck of an acronym. It stands for Association of University and College Counseling Center Directors. And we were always talking about what's going on, and we have a survey that we do every year. So this is just some points that we find out from that survey. Average mental health staff to students is about 1 to a little over 2,000. About 10% of the student population will seek counseling. At FGCU, we find it's a little higher. It's more like 11 or 12%. Over a third of counseling centers report having a wait list for students seeking service. We've had a wait list for the last 4 years. 94% report they believe that the trend of students with severe psychological problems continues to be true on campuses. 43% of the clients treated had severe psychological problems. So this is what counseling center directors are saying. We did something kind of unique a few years ago, actually in the fall of 2014. The Board of Governors of the state university system wanted information from all the counseling centers. They were concerned about the mental health of our state university system students. So they asked us to pool our data, and we came up with these averages. We all use the same database system called Titanium, so it's a very easy thing to do. So this is what 12 counseling center directors in the state university system found for the students attending their counseling center. Experienced trauma, 47%. Seriously considered suicide, over 32%. Taking psychiatric medication, 32%. And so forth and so on. So these are the things that we're finding on our counseling centers, not just at FGCU, but throughout the state university system in Florida. Newsflash. College students drink, and they also use pot. The main question that everybody asks about college student drinking is called the binge drinking question. It was created over 25 years ago by the Harvard School of Public Health, and it's been the same framed the same way. Over the past 2 weeks, have you had 5 drinks or more in a sitting? What's special about 5 drinks? Well, basically, we know that gets you to a high enough blood alcohol concentration that you would be considered intoxicated. So that's the question that's been asked for years. And there's FGCU's binge drinking results. And we have some results from the instrument I just shared with you, the National College Health Assessment. And I have also the data from something called the CORE survey, which is just about college alcohol and drug issues. So we have some variance there between the 2 estimates. But what I want to point out is, in this regard, FGCU is always below the national reference group. I think that's because when we started at FGCU, we really were very concerned about this. And I can remember back in 1996 when we were talking about starting the university, we were very focused on this. So we've done a lot of training with faculty, staff, and students. So we've always been below the average, and that's a good thing. So when you ask the question within the last 30 days, did you use alcohol? We have about 56% that indicate they have. We ask about marijuana, and we ask about other drugs. And in the other table, we present the results from the CORE survey. So you can see that there's not much difference in terms of 30-day use of alcohol. There is a bit of a difference in marijuana, but we still are below the rest of the college student world in terms of using alcohol, but we're probably pretty average in terms of pot. I tell the administration we don't have an alcohol problem, we have a pot problem. All right. So, why do college students drink? Let me show you something that I always find kind of interesting. This is the actual use in 30 days, okay? 56%, 16.2%. But then you ask them, do you use? And then you ask, what do you think your fellow peers have done, your fellow students? And if you look at those percentages, you'll see something that's astronomical. They overestimate. They really don't know. They think 95% of students have used alcohol in the last 30 days. And they think that everyone is smoking weed, 92.3%. So students don't really know. They exaggerate and they have misperceptions. 85% of students believe the average student on their campus uses alcohol once a week or more. 69% of students believe the average student on campus weekly uses some form of illegal drugs. Big misperception. So you ask students, why do you think people, you and your fellow students, drink on your campus? And this is what they say. I always get a kick out of this. 20% believe it makes them sexier, men in general and women in general. I must have hung out at all the wrong bars when I was in college because I never ran into a sexy drunk woman. 38% feel it facilitates sexual opportunities. I can believe that. 43% believe it makes it easier to deal with stress. 50% believe it facilitates female bonding. And 53% say it facilitates male bonding. So you don't get together or bond if you don't use alcohol. And the big change in that and those figures have been for females. So here we go. Here's some more. 57% believe it allows people to have more fun. Can't have fun unless you're drinking. 58% say it gives them something to talk about. If you can't talk about how much you drank, then I guess you don't have anything to talk about. 61% believe it facilitates connection with peers. 64% believe it gives people something to do. You don't have anything to do unless you go and drink. 70% believe it breaks the ice. And 73% say it enhances social activity. So this is what we're up against. All of this misperception and exaggeration. It's why we do the alcohol and drug education programs that we do. Every year, over 1,100 college students die. And my question is, from what? You may have fallen victim to a recency effect there if you said alcohol. The answer is suicide. It's the second leading cause of death for college students. Most recent data indicates suicide is 30-year highs across all U.S. age groups. There's the rates of suicide for college students and matched age groups. And it is the reason we do suicide awareness and intervention programs on university campuses, and particularly at FGCU. Now, I'm going to shift gears, get rid of some of the doom and gloom, and I'll talk to you about the services that we have here at FGCU, how we tackle these problems, how we support your student in terms of their health and wellness. The first office I want to talk about is prevention and wellness. This is an office that connects students to relevant wellness information. They do a lot of programming, do a lot of events, they do a lot of peer education, health promotion. They maintain a lot of online tools. And you can walk into the lobby and basically pick up a lot of information about health and wellness concerns. That's where they're located in Howard Hall. You've walked by it already. And those are their office hours. The program hours are really flexible because they do them at night in the residence halls. You know, they do programs at 10 o'clock in the evening. Prevention and Wellness is known for its Peers Care program. This is a group of undergraduate students who are trained as peer educators at various topics related to student health. Peer educators share a lot of the health and wellness information with other students in a fun and engaging way. So it's students teaching students, and they have fun doing it. They present programs to fellow students on information related to alcohol, drugs, stress, and nutrition, just to name a few. One of the things that I want to stress, I'll make a couple of pitches, and this is one pitch I will make. Prevention and Wellness monitors the program called My Student Body. And my pitch is, please, please, please get your students to do this before they even come to FGCU. This is an interactive online wellness program. The completion of what they call My Student Body Essentials is a university requirement, and all new undergraduates, transfer, or dual enrolled students have to take this, this program. And if they don't get to register for the second semester. So get them to do it now, and there won't be any delays. There's an email from My Student Body that will come to all students right after they have come to orientation. But there'll be an email. I'm not sure exactly when. This is Adaptive Services. This is our Student with Disability office. This is located in the Wellness Center. You've walked by this a number of times already in the plaza. Those are their hours. And they do stay open longer hours because of the services they provide for students with disabilities. I make a pitch about adaptive services, and that pitch is that please, 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 if your student has a disability, have them register in adaptive services. A lot of times students come to college and they say, well, I don't need that, and I think I can manage, and that's not the case. They come to school, they don't register, they don't get accommodations, and then after they've had that first midterm or later in the semester, they say, well, I'm not able to keep up, and then it's too late. So have them register in adaptive services as soon as possible. What they do is they provide accommodations and services to students with documented disabilities. It needs to be documented. You can stop in the office and pick up this information and fill out the form and get the documentation. Accommodations are based on individual need, and there's some examples of accommodations. One of the significant services, I think, is the tutoring that's available for specific subject areas. It's hard to find one-to-one tutoring, but Adaptive Services provides that for students who have a disability. There's assistance with study skills. They provide information about test-taking strategies and so forth. They also have peer mentoring. They have students who again, mentor other students. They have general advising and counseling related to disabilities. And they even have a student organization called Eagles Gather. So this is a very critical service for students who have disabilities. Talk about the Student Health Center. This is an accredited student service. It's accredited by the Association of Ambulatory Healthcare. What that means is basically we've achieved a standard. There's the hours, and the phone number is kind of important. That was the last time I was creative in 1998 when we started the health service here at FGCU. I got to pick the phone number. So I chose, everything was 79 something, and I chose 7966 because it sounded like sick. That was the last time they let me be creative. But that phone number is really important because they can call that number anywhere 24/7 and talk to someone about their health issues. So it's real important. These are some of the services. It is confidential and free. Free is a misnomer. You've already paid for it. If you've paid tuition, you've paid a health fee. It doesn't cost them anything to be seen, but you've already paid for it. They use electronic health records like most primary health care facilities. They provide routine medical care, general physical, women's health, vaccinations, birth control, and we have a small pharmacy and maintain some medications. We sell all the medications at cost to students. So your student needs to understand something about what your copay is for medications and compare that to the cost at which we sell the medications. We do sexually transmitted infection testing. We have after-hours medical advice service, as I said, the phone number, and we have some supplies. The health center is staffed by medical directors, nurse practitioners, registered nurses, and medical assistants. We really have a very good staff. They're really highly qualified. And the one point that we always make is that if your student is under 18, they need your permission to be seen by our primary health care practitioners. So if your student's not going to be 18 when they start, please stop in the health center and pick up that form. You can sign it and leave it right there at that point in time. Student Health Center is a busy place. They had over 13,000 student visits. We recommend everyone get an appointment, although you can walk in. If the student's willing to wait, they could be seen, but we recommend appointments. 40% of the student population visit the health center in a year. And only 83% of our students have health insurance, which means 17% don't. And for those students, the Student Health Center is very important. There's the number of labs, there's the number of vaccinations, and we're really disappointed we aren't giving more flu shots. Maybe after last year we'll be able to provide more flu shots. I want to talk to you about student health insurance. Student health is voluntary. Gallagher is the service that we contract with. It's not required to receive services in the Student Health Center. It's available semester by semester. A payment plan is available. And it is really very affordable and competitive. As I said, students are really healthy, so the cost is pretty low. And it really is good coverage. You just need to check it out. I can't tell you what decision to make. You just need to go to that website and check it out. Okay, here's some tips for students. If your student is sick, tell them to go to the health center first. It's free, accessible, and a good first response. If they are told to take pain relievers, drink fluids, and get plenty of rest, please encourage them to follow that advice. I always tell the story of when I walked out, the Student Health Center used to be on the plaza. And I was walking across the plaza and the student came out of the health center and she She was complaining to her parent, I assume. Well, they only told me to get rest and drink fluids. And my hope would be that the parent on the other end of that line said, well, that's good, honey, you're not going to die. Just follow what they say. We don't pass out medication if we don't think it's warranted. Advise that it's best to make an appointment. I've already made that point, but I want to reiterate it. Remind them about after-hours medical advice phone service. They can find out how they're doing with their health anytime, anywhere. There will be cost recovery charge for labs and medication. Again, you know, we don't make any money, we just charge cost, but you'll be amazed how inexpensive it really is. So your student needs to understand those things. Ask them if they are keeping up with their sleep and dietary needs. We do have nutritionist services available. They can see nutritionists in the health center or the counseling center at no cost. So they can learn to eat right. Well, let me switch and talk about counseling and psychological services. It's always known as CAPS. We are also nationally accredited. And we're located on the second floor of Howard Hall. Those are our hours, our office phone, and we also have a 24/7 helpline, and we call it our EARS line. And we pass out EARS cards all the time to students so they know that someone is there to talk to them if they're struggling emotionally or behaviorally. Here's our services. We have a walk-in service operation. In other words, we don't make any first appointments. All students have to do is walk in the door. So if they say, well, I tried to go into CAPS, ask them if they walked in the door. That's all they have to do. We have personal counseling and therapy. We do function on a short-term model. We see some students for a longer period of time, but we try to do things as quickly as we can in a helpful way. We have group counseling and therapy. We have a psychiatrist, a full-time psychiatrist works in CAPS. We do consultation and referral. We'll always see students. We'll always consult with anyone, and we're able to refer students if they need to see someone for a particular issue in the community or if we can't see them for whatever reason. We do case management. These are students who largely have been on medication and just want to continue that medication. So our psychiatrist provides case management. We do outreach programs. We do try to prevent these issues. So far this year, we've done 164 programs. We do career counseling. We have assessment services. We do disability testing for LD and ADHD issues. And again, I want to emphasize that we have after hours and emergency on call 24/7. I want to emphasize our website. It is very helpful. There's a lot of information. Students can take the survey and find out whether or not they're anxious or depressed or whatever in the privacy of their room. There's a lot of other really great information on our website. So we encourage students to look at it. You can see we have increased users since 2013. What we find is that with enrollment increase, we always exceed whatever percentage of enrollment increase by about 5 times. In other words, if we increase 2%, our enrollment or our unique users increases 10%. It's just the way it is. We know that we do a good job in CAPS. We know that we have high student satisfaction ratings. And this is just what we found from 2013 to 2016. We find that 95% of the students agree they were comfortable using CAPS services, would use them again, and would refer others to CAPS. 60% agree that counseling enabled them to better focus on academic and study requirements. And 67% report that counseling made it possible for them to continue as a student. We know that we are effective and we know that we impact retention. These are the reasons students come to CAPS, no surprise. Anxiety, stress, depression, self-esteem, so forth. This has been pretty consistent as well. And this is students telling us why they came. It's not our estimates of issues. So, when should you be concerned about your students' mental and emotional health? When you see some major changes, things like social withdrawal, marked change in appearance, motivation, self-care, and hygiene, excessive self-criticism, tearful calls outnumber the others. The first 2 weeks do not count. Talks of hopelessness, if they refer to self-harm or suicide, that's when you can become concerned. Another tip I share is related to developing resiliency. If your student has had psychological issues that require counseling and therapy and/or psychiatric medication, refer them to CAPS from the start. I've said we get very busy and sometimes we have a wait list, but if they get in our system, we can see them. Keep the communication lines open, listen and be accepting. Find out if going to college is fulfilling their goals. Are they happy? College isn't for everyone. The national statistics in terms of students in state universities indicates that 1 out of 4 don't come back after their first year. And that's not a failure. It just may be that they miss all of you or they're not ready or whatever. So you need to ask them if it's fulfilling their goals. Ask about what they're discovering regarding their career choice. Students change their major. It's a very normal thing. The average student changes their major 3 or 4 times. So don't get concerned about changing a major. Ask about their relationships, how they're going, how they're getting involved. Don't overreact, and don't ask about, are you making friends? But you can find out how they're doing in terms of relationships and how they're getting involved. Ask them about how they're eating, sleeping, and what they are doing with self-care and balance in their college life. That's important. That's resiliency. Ask them about the pressure and stress they're feeling. Try to help them see through it and be supportive. Model problem solving. Talk up being flexible, adapting, accepting of the tough times, and learning how to cope. Don't fix things for them. Help them solve the problem. Normalize the idea of seeking help. Let them know it's not a sign of weakness. We have lots of resources to help students, from academic issues to personal issues. For example, they can come to CAPS for a consultation, or at least go to the CAPS website to do a screening, or use the self-help resources. College is all about learning about self in addition to academics. It's an exciting time, but it's also a time to build resiliency. Tell them you understand college students drink, but that you would hope that it does not interfere with their academic or social life or put them or their friends at risk. Explain what you mean. Talk about alcohol. I will close with the developmental issues. These are things that you and your students are going through at the same time. First of all, for parents, you're trying to learn to trust your students, and I know for some of you that's a little harder to do. You're redefining yourself. Your role changes from a caretaker to a mentor. I know you pay the bills, but if you think you're still in charge, you need counseling. Some of you are managing some anxiety over this separation. Talk about that. Get support. And you're trying to find a different way to stay close without being overly involved. For students, they're trying to achieve confidence and identity. They're trying to become separate and independent. And they're trying to manage emotions and achieving intimacy. So this concludes my presentation. I hope this information has been informative and helpful. The more you know and the more you understand as parents, the more you will be able to help your students and to partner with us in that endeavor. I will be around and answer any questions. We'll have some time left. And I will stay during the lunch time if you want to talk with me about a personal issue with your student. So thank you very much for your attention.